Today I'm remediating week 3 practice OSCE, skin, hair, and nails. So starting off the OSCE, the student sets up the environment to promote patient confidentiality and safety by drawing curtains and closing doors. The student introduces themselves formally using their full name and identification from the specific institution and states their role. The student is dressed in professional attire and wearing proper ID. The student uses appropriate biological procedures and washes hands for a minimum of 15 seconds or until hand sanitizer is dry. The student gathers appropriate equipment and makes sure all instruments are sanitized. The student asks the patients for first name and birthday and double checks with their armband and asks the patient how would they like to be addressed. Moving on, the student asks the patient for their reason for seeking care, or rather say chief complaint. The student gathers demographic data such as age, occupation, and marital status. Moving on, the student questions the patient about the relevant skin, hair, and nails. So the student asks about previous history of skin disease such as allergies, hives, rashes, or even eczema. The student also asks about severe sunburns, particularly during childhood or adolescence. And lastly, environmental or occupational hazards, dyes, toxic chemicals, radiation, and hobbies, households, or furniture repair. The student questions the patient about any relevant family history of relevant skin disorders, for example, skin cancer or eczema. The student proceeds with brief, focused subjective data collection, and this is where the student is responsible for asking about the OPQ RSTUA. So onset, palliative or provocative, quality, region or radiation, severity, timing, understanding, and associated symptoms. For onset, it's more of like when has this specific lesion become noticeable. For palliative or provocative, what makes it better or worse? So baths, lotions, cold or heat. For quality, describe the lesion's feels. Is it an itchy feeling? Is it a burning feeling? For region or radiation, where's the lesion located, and does the pain radiate throughout the body or to different lesion? For severity, so on a scale of 1 to 10, how has the lesion impacted your daily activities? For timing, has the lesion changed? Has it progressed? For understanding, what do you think this is? And for associated symptoms, any other symptoms, allergic, excessive dryness, or anything else. For the 9th step of the OSCE, the student proceeds with brief, focused subjective data collection. So the student asks if the patient is using any herbal medications prescribed, and the student asks the patient for all of the following allergies, medications, food, or eventual allergens. Moving on, the student asks about self-care lifestyle behaviors, specific to skin at least. So we ask about DATS PIES. So DATS PIE stands for diet, alcohol, drugs, smoking, physical exam, immunizations, exercise, and lastly stress. For diet, we ask about their usual diet or any foods or any new foods at least. For alcohol, any alcohol use or abuse. For drugs, have you taken any drugs, and if yes, which type? For smoking, do you smoke cigarettes or tobaccos? For a physical exam, do you examine your own skin? When was your last exam? And for immunizations, relevant to today's day, COVID vaccine. Exercise, what is your usual amount of exercise? And for stress, tell me about your stress in your life. What are the main causes? How do you manage stress, and how does it affect you? The student asks one additional question related to self-care behavioral of skin, hair, and nails. For example, what do you do to care for your skin, hair, and nails? What cosmetics, soaps, or chemicals do you use? Moving on, the student nurse asks an abuse assessment screen, questions with appropriate preamble. Example, because violence is so common in our society, we ask all patients who come to our facility if they experience any abuse. Next, the student reports doing a general survey, including at least one descriptor for each of the following components: physical appearance, behavior oriented times 4, mobility, and body structure. The student proceeds with a focused physical exam of skin, hair, and nails. The student states that they would wear gloves if they anticipate contact, mucus, blood, and any other body fluid when palpating any areas of the skin lesions. Moving on to step 16 of the OSCE, the student inspects and palpates patient's skin and reports generalized skin color, moisture, temperature, texture, mobility, and turgor, edema. When inspecting and palpating the patient's skin, we report for generalized skin color. Moisture, we assess for moisture by assessing using palmar surface of hands. When assessing for temperature, we assess the dorsal surface of our hands, and when assessing texture, we assess using plantar surface of our hands. Mobility and turgor, and M-Adel assesses anterior chest near the clavicle. And edema, we assess lower extremities, legs and feet bilateral for accumulation. Moving on, the student inspects any present skin lesions and states that they would use a magnifier and a light for closer inspection for any lesions as needed. When inspecting for color of lesion, we inspect for the surrounding skin color, and elevation, we inspect for whether it's flat or raised. We inspect for pattern or shape, if it's grounding or distinction. We inspect for size in centimeters. We use a ruler to measure. And lastly, location and distribution on the body. Moving on to step 18 of the OSCE, the student palpates and any present skin lesions. So we palpate for depth, height, and we gently roll a nodule between the thumb and index finger to assess. We palpate for scrape scale, knot base, and bleeding. Temperature of surrounding skin, any exudate, drainage, color, and odor, bleaching and stretching. Next, the student is able to state a minimum of 2 terms for describing each of the characteristics of the different primary and secondary skin lesions. For primary skin lesions, some characteristics that may be used are papule, patch, plaque, and secondary characteristics are crust, scale, and scarring. Moving on to the 20th step of the OSCE, the student assesses and notes any abnormal characteristics of moles and pigmented lesions. So this is where we assess for the ABCDEs of moles. So A for symmetry, B for border or irregularity, C for color variation, D for diameter, and E for elevation or ovulation. Moving on, the student states at least 3 common skin lesions. For example, primary contact, dermatitis, allergic medication reaction. Step 22, the student inspects and palpates the patient's hair. When palpating the patient's hair, we palpate for color, texture, distribution, and lesions. The student inspects and palpates the patient's nails. So when palpating the patient's nails, we palpate for shape and contour, consistency, and color. Then the student inspects and palpates the nail beds for capillary refill in both hands and reports that the color should return in less than 3 seconds, which indicates adequate peripheral circulation. Then the student performs basic health teachings with patient on at least one following topic, such as health considerations, risk factors, tanning, and skin cancer.